Hi, my name is Rhoda Palacio. I am a master's degree in nursing administration and leadership student of Roberts Wesleyan College. I'm here to present to you today the concept of interprofessional collaboration in healthcare. This presentation's objectives are to define the concept of interprofessional collaboration as it applies in healthcare setting and discuss the significance of interprofessional collaboration in care delivery, to identify the three specific healthcare concerns that necessitates interprofessional collaboration to improve healthcare outcomes while identifying nurse leaders' role in adapting interprofessional collaboration concept and practice. And three is to describe the significance of capstone proposed evidence-based practice change as it applies to our current clinical setting, and to describe how specific interprofessional collaboration strategies can be applied in the design, coordination, and evaluation of the proposed practice change. Interprofessional collaboration involves multiple healthcare professionals interacting and bringing together a range of functional expertise to achieve a common goal. It is a conceptual relationship between coordination that is defined by working together to achieve shared goals. And cooperation is when one contributes, understands, and values the contribution of other team members. Shared decision-making is when every member of a team rely on negotiation, communication, openness, trust, and a respectful power balance. And partnership is when open, respectful relationship cultivated over time in which all members work equitably together. Healthcare professionals working in a partnership with patient, family, caregiver, diverse team of highly specialized healthcare professionals towards a shared decision-making, coordination, cooperation, and communicate each other's unique perspective are essential in delivering the highest quality of care in healthcare. Therefore, this is true definition of interprofessional collaboration in healthcare. The passage of Patient Protection and Affordable Care Act has significantly changed today's healthcare climate, focusing on patient safety, prevention of patient readmission, and initiatives to reduce healthcare costs. The federal government's goal is to incentivize healthcare providers to improve quality and patient outcome by tying reimbursement to cost savings, quality measures, service, and efficiency. The Centers of Medicare and Medicaid Services encourage providers to create an interprofessional care team for the purpose of coordinating care, educate patients to promote self-care, and identify and treat healthcare conditions sooner than later, and help patients effectively manage chronic conditions to improve overall patient health outcomes while reducing healthcare costs. It is also shown based on evidence that collaboration in healthcare have improved patient outcomes such as reducing preventable adverse drug reaction, decrease in morbidity and mortality rates, and optimized medication dosage. Therefore, through effective collaboration of interprofessional team is a major key factor to succeed in today's healthcare environment, not only to achieve the best patient outcome, but also achieve the financial bottom line in every healthcare system. Nurses are poised to assume roles to advance health, improve care, and increase value while taking the lead to making healthcare more patient-centered and quality-driven. As the nursing profession moves forward in the 21st century, all professional nurses should implement evidence-based programs to support transition to praxis and help create an interprofessional collaborative environment. AACN and 5 other nursing organizations has established interprofessional education collaborative with the goal to advance interprofessional learning experience for nurses and promote team-based care approach. The IOM's 2015 Campaign for Action report from the Future of Nursing Leading Change, Advancing Health states the importance of valuable abilities of registered nurses to collaborate with patients, clinicians, educators, and researchers with greater attention to targeted areas such as removing barriers to practice and care by taking the lead in the innovative improvements in healthcare, transforming education by incorporating new knowledge into practice, collaborating or collaboration and leadership through networking, participation in policy development, and reducing barriers that prevent registered nurses from working to the optimal level of their education. And registered nurses are suited to lead with initiative that improves care by patient-centric care, promoting diversity, and improving data and quality of care based on evidence. The capstone project proposal of incorporating patient-centered care model as the evidence-based burn nurse competency conceptual framework is the practice change that will provide the solution to a practice gap of inadequate nursing practice competency guidelines for burn nurses in our clinical setting in order to effectively facilitate delivery of care to all burn patients, provide structure to current nursing practice, and help improve burn patient outcomes. In order to provide an optimal level of care to every healthcare system, it is important to have a well-established evidence-based clinical practice, competency guidelines that can promote effective nursing care modalities and help deliver safe patient care. The proposed practice change of implementing burn nurse competency is an opportunity to increase nursing skills and knowledge base to effectively facilitate quality care delivery for burn patients from admission to discharge. Interprofessional collaboration is the key component to enable to develop and facilitate such evidence-based change through collaboration of project manager, unit educator, nursing leadership team, and utilization of staff's feedback. Upon implementation of the proposed practice change, the entire nursing staff will be empowered to apply the principles of patient-centered care and adapt the 11 domain of evidence-based burn nurse competencies. Through each domain necessitates the need to collaborate with different interprofessional burn team, which consist of burn service medical director, behavioral health support such as psychiatric consult and behavioral nurses specialist, unit care coordinator, social worker, nutritionist, physical therapist, and occupational therapist to effectively advocate for burn patients' needs and facilitate safe patient discharge. Nurse leaders' role has been recognized as a critical element in the process of making evidence-based practice a reality throughout an organization, which entails application of strategic and functional leadership behaviors which demonstrate vision-focused and system-oriented thinking. Formal and informal leaders who support evidence-based practice were key players for a successful implementation of evidence-based change. They demonstrate strategic and functional behaviors such as strategic thinking, effective communicating skills, ability to build and sustain an evidence-based supportive culture, inspiring and inducing, actively intervening and involved in evidence-based practice, educating or developing or role modeling, monitoring and providing feedback or seeking insights, and implementing specific evidence-based practice projects. The key determinants of collaboration includes a team leader who understands and manages diverse interests among members and capitalize on the strength of the team composition by developing strategies to identify opportunities, ability to engage, and willingness of the members to work with the team in a collaborative way. The project proposal of implementing evidence-based burn nurse competencies will utilize these collaborative strategies between the project manager, unit educator, unit leadership team, and burn program and data analyst and nursing staff during the development of the project design, coordinating competency development and facilitation of staff education, project implementation, and evaluation based on specific measurable patient outcomes. There is a significant value of utilizing interprofessional collaboration between all stakeholders involved during the development, implementation, facilitation, and evaluation of patient outcomes of the proposed practice change of implementing evidence-based nurse competencies in our current clinical setting. The need for dynamic interprofessional teamwork and team building processes requires creativity and flexibility within work groups. Open communication, active listening, and setting a well-established goals are a key component of a successful implementation of evidence-based change. Healthcare teams that supports evidence-based practice clearly requires a great innovation and collaboration among organizational leaders, and nurse educators to bridge the gap between practice and education. Our institution's executive leaders, healthcare providers, associate director, and nurse managers on every inpatient and outpatient settings are very well supportive of any innovation that promotes evidence-based practice. They are fully accountable to facilitate and uphold compliance with all standards of such evidence-based practice initiatives. In conclusion, nurses in leadership role have a major role in every aspect of nursing practice in order to meet the demand of the ever-changing healthcare climate. Nurses' active role will ensure that the provision of high level of care for a specific patient population are being facilitated in order for them to achieve their best outcome. Healthcare organizations should support nurses in taking the lead in identifying healthcare concerns, cultivate the spirit of inquiry, implement available evidence into practice, develop a collaborative interprofessional relationship to support positive work attitude and behavior that can affect patient outcomes. To develop strategies that foster effective communication and collaboration between clinicians, staff, and patient while complementing their continuing education needs. The value of effective interprofessional collaboration in healthcare and during implementation of evidence-based practice change highlights the foundation of care delivery that when efficiently used, healthcare becomes free of complication, errors, and wasteful spending that will drive an optimal healthcare system in today's healthcare climate. Thank you. I hope you enjoyed this presentation.